Hi everyone, my name is Hannah and I am doing my monograph over heart failure. So a little bit about me, like I said, my name is Hannah. I am in the accelerated program at Trinity and I'm interested in heart failure because I'm considering being a cardiac nurse in the future. And on top of this, I was on the 7th floor for clinical when we picked our monograph topics, and a good majority of my patients had heart failure, so I thought this would be a good topic to research and implement interventions for them while I was caring for them. So for this patient in particular, she was admitted for increased shortness of breath and had a possible COPD exacerbation. She had 2 prior cardioversions 1 week before admission to Trinity. She has a history of AFib, so her cardioversions took place within about 3 days of each other, and then she was admitted. Her past medical history includes COPD, AFib, and chronic bronchitis. So some important information I gathered on her included her assessment, medications, and diagnostics. For her assessment, my nurse and I found that her breath sounds were diminished. She had bilateral upper and lower lobe expiratory wheezes. For her cardiac assessment, she has a history of AFib, but she was cardioverted, so now she is in normal sinus rhythm. She also had some tachycardia. For her vascular assessment, she had edema in her right and left lower extremities. It was non-pitting. Her pulses were 2+ in her right and lower left extremities. The meds that she was taking were Lasix, amiodarone, and metoprolol. Lasix is a loop diuretic. It works by inhibiting electrolyte reabsorption from the kidneys and enhances excretion of water from the body. Amiodarone is an antiarrhythmic and it relaxes overactive heart muscles, so that would be for her AFib. And metoprolol is a beta blocker, which inhibits beta-1 adrenergic receptor, which decreases cardiac output, so her heart is going to beat more slowly and with less force. Some diagnostic tests that she had done was a transthoracic echo, a chest x-ray, and a 12-lead EKG. Her transthoracic echo showed that her left ventricular systolic function is moderately decreased. She has an ejection fraction of 45%. She has moderate bilateral enlargement of her atria. There is some aortic valve sclerosis without stenosis. There is moderate mitral annular calcification. She has mild to moderate mitral valve regurgitation as well as mild tricuspid valve regurgitation. Her chest x-ray showed pulmonary infiltrates. The infiltrate on the right was greater than the left, and she had a small left pleural effusion. Finally, her 12-lead EKG showed that she was in normal sinus rhythm. She had probable left atrial enlargement, which was confirmed by the transthoracic echo. So the Mosby evidence-based nursing monograph is set up, which started out with pathophysiology, so it defined the disease process of the topic. Clinical classification, which is the severity of heart failure that patients could be in. Current practice included signs and symptoms, diagnosis, and treatment of the disease. Next, we have current literature, which is evidence-based research, which I pulled 2 articles, which I'll talk about a little bit later. And then finally, evidence-based nursing. So it is our nursing process, which is assessment, diagnosis, planning, implementation, and evaluation. The heart failure monograph defines heart failure as a chronic progressive condition that impairs the ability to fill or eject blood. and this can be caused by ventricular dilation, which is when the ventricles stretch and then thin since they were stretched. Ventricular hypertrophy, which is the enlargement of and thickening of the ventricles. Venous congestion, which is when the outflow of blood is obstructed. And finally, inadequate oxygenation to the body. The two articles that I pulled from my monograph were cardiovascular nursing interventions and nurse-led titration of heart failure medications. And I'm going to talk a little bit about those and how they relate to my patients that I'm talking about in the monograph. The first article is called Randomized Trials of Nursing Interventions for Secondary Prevention in Patients with Coronary Artery Disease and Heart Failure. The level of evidence is 1 for this article. It is considered a level 1 because it is a randomized controlled trial and it is the highest level of evidence. The main research question asked in this study was, do cardiovascular nursing interventions improve outcomes of patients with coronary artery disease and heart failure? They used electronic databases such as PubMed to gather all of their studies that they would be analyzing to determine if they would be a good fit for this particular study and their research question. The researchers only used randomized trials in this study. They used specific keywords to narrow down their search and ended up with a total of 2,039 citations from the databases that they were searching in. In these trials, they had a good sample size as well as patient population. The researchers revealed that nursing interventions for secondary prevention in patients with coronary artery disease or heart failure have a beneficial impact on blood pressure, lipids, physical activity, dietary intake, cigarette smoking, weight loss, healthcare utilization, mortality, quality of life, and psychosocial outcomes. So overall, this research article shows how important nursing interventions for secondary prevention of heart failure can be when it comes to those specific outcomes. So for my patient in particular, there would be a lot of education on lifestyle modifications of how she can get her heart failure under control and not make it any worse than it already is. Some big lifestyle modifications that my patient could do is to stop smoking, start exercising more often. She should also modify her diet, so she should eat lots of fruits and vegetables, and not eat so much saturated and trans fat. The next article I chose from the monograph is called Nurse-Led Titration of Angiotensin Converting Enzyme Inhibitors, Beta Adrenergic Blocking Agents, and Angiotensin Receptor Blockers for patients with left ventricular systolic dysfunction. This article is another level 1 evidence article that collects randomized controlled trials related to their research question. The authors are researching the effects of nurse-led titration of specific heart failure medications, which include beta blockers, ACE inhibitors, and ARBs. They are looking at the correlation between individualized doses and patient outcomes. Specific patient outcomes the authors are looking for are overall hospital readmissions related to heart failure, and overall mortality. Driscoll et al. State participants in the nurse-led titration group reached maximal dose of beta blockers in half the time compared to the participants in usual care. Patients are able to reach a therapeutic dose of these medications quicker, which will lead to better patient outcomes such as decreased hospital readmissions and mortality. Nurses can play an integral role in the improvement of heart failure care by participating in nurse-led titrations for heart failure medications. This could be an important nursing intervention for my patient with heart failure. Titrating her beta blocker, metoprolol, to the correct target dose could improve her outcomes as the research shows. After reading this monograph, I have a better understanding of how heart failure occurs and the best care to provide the patient. I was able to dive into some current research that can be applied to the patient I cared for. Staying up to date on current literature is important for health professionals to find new and improved ways to treat patients. This monograph is helpful to refer to the nursing process when caring for a patient with heart failure. There is an in-depth description of each component of the nursing process when caring for a patient with heart failure. In conclusion, the assessment findings of the patient I cared for indicate heart failure. Throughout the time my nurse and I cared for her, we were able to apply as many components of the nursing process to formulate a specific care plan to create the best outcome for our patient. After reading this monograph, I feel more comfortable with the pathophysiology of heart failure and how to care for patients in the future. And that is the end of my presentation. Thank you so much for listening.